need after at least 6 youth suicides in the past year. Wendy Panich chairs the Our Healthy Clarence initiative, which aims to improve mental health in the region. Wendy was at the meetings with the Minister today and joins me now. Wendy, thanks so much for your time this afternoon. How did those meetings go?
Look, incredibly well. The Minister spent the entire day in Grafton today, and I participated in most of those meetings, and really happy with the extent to which the Minister listened and asked, really meaningful questions about what it is that can be done to be able to help in the Valley.
Let's just talk about the funding for that Headspace Centre and also suicide prevention services. Is that what's needed in your view?
It's a really good start. There are a lot of things that are needed in any community to address suicide and to improve wellbeing and to improve mental health. There's no funding announcement that is going to be the answer to everything in a community, but it's a fabulous start. We know that young people really need access to services in the Clarence Valley, and the community has been asking for quite some time for a Headspace Centre. So it's really a testament to them that the centre has been announced today. And yeah, it'll be great for youth mental health. But he also announced training for the community in mental health first aid and training to be able to respond to somebody who's at risk of suicide. And he also announced some increased psychiatry services in the region for adults and for children. So those are all really useful starts to address the issues.
Wendy, as you've mentioned, young people all around need support and need services, not just your region alone. How do you avoid your area sort of having a label, in a sense, when you mention the number of suicides taking place? It's a careful balance, isn't it, to strike, where you're not sending this message that this is your region only in trouble, but this is broadly a problem amongst a lot of young people.
It's absolutely not that Grafton is especially different from anywhere. I manage mental health at the Primary Health Network, and we know that we have a range of areas within our region with, unfortunately high suicide rates. We're also working in other communities doing the same kind of work to address mental health, and it's just really important to note that Grafton's not alone, and that work is happening.
Wendy, just give us a sense of, particularly in these smaller regional and rural areas where people know each other much more closely often than in metropolitan areas, just the impact through a community. You've got parents, schools, many people connected to people who struggle with their mental health, those young people.
I think it's something that we weren't coming across when I was a teenager, and it's largely social media. There's a lot of great things about social media, but we met with a group of young people today who freely acknowledged the role that social media plays in their lives, but also the impact that it has on communication about things that don't go well, and then the impact that can have on young people always feeling like things aren't going well.
All right, Wendy Panich, thank you so much for your time today. I know it's been a very busy one for you, so we really appreciate it. Thank you.